Have you ever wondered, what is an exercise physiologist? Maybe you've been told to go see one. Well, in this video, I will talk about exactly that, and I'll also touch on how exercise physiologists are different from personal trainers and physiotherapists. Hi guys, my name is Hassan Qureshi, and I am an exercise physiologist here in Sydney, Australia. So in a nutshell, exercise physiologists are healthcare professionals who specialize in the prescription of exercise. So if you think of exercise as medicine, we're the people who prescribe it. And in so doing, we can help you manage or even prevent various injuries and chronic conditions. But that's not all. Exercise physiologists are experts when it comes to lifestyle modification and behavior change. Because let's be honest, we all know we need to exercise. But the question is, how do we make exercise part of your routine, despite all of your excuses? Challenges. So just like doctors prescribe specific medications for specific conditions, we help prescribe exercises tailored to individuals' needs. So for example, the exercises you do to better manage your diabetes are very different to somebody exercising after a heart attack or following a knee replacement, for example. But they're both using exercise as a treatment modality. So exercise physiologists work across a range of settings with a range of clients. Just to give you an example, in our private practice, we see clients from with lung conditions such as COPD to people with metabolic conditions such as diabetes. We also have clients who are injured at work, and we help them return to work through work cover. Along with that, we have clients under NDIS and with various disabilities, both physical and psychosocial, and we use exercise to help them achieve their goals. We also have clients undergoing cancer treatment, be it radiotherapy or chemotherapy. And again, we're using exercise to help them get stronger and fitter. So as you can see, the scope of an exercise physiologist is quite broad, but the key thing is we're using exercise as our primary treatment modality. So I've been an exercise physiologist for about 10 years, and every time I explain what it is that I do, people tend to ask one of two questions. Firstly, how are you different to a personal trainer? And that's a great question. Both are professionals that use exercise as the main tool of their trade. But the difference is, exercise physiologists are specially trained to work with clinical populations, so people that have certain chronic conditions or medical conditions that need tailored interventions. On the other hand, personal trainers typically work with clients that we call generally healthy, or the healthy population, and they'll work on goals such as fitness, weight loss, and improved strength and well-being. So therefore, the training and education between an exercise physiologist and a personal trainer will vary quite significantly. So just to give you an example, exercise physiologists are typically university trained and accredited. That's a minimum 4 years of university to become an exercise physiologist. On the other hand, personal trainers can do certifications in 2 to 3 months. Now the other comparison is exercise physiologists with physiotherapists. And in some ways, those two are more alike than exercise physiologists and personal trainers. The reason being, they're both working with clinical populations within the healthcare settings. Two major differences that I would say between physiotherapists and exercise physiologists is the difference in treatment modalities, and we could summarize that by saying more active versus more passive. Exercise physiologists use exercise as their primary treatment modality, whereas physiotherapists have a range of other treatment modalities in their arsenal. So things like massage, TENS, acupuncture. Now, a number of these treatment modalities are what we call passive treatment modalities, right? So it's the client is lying on a plinth or bed and they're being treated upon. And of course, there's a time and a place for that type of treatment. And the other big difference would be in terms of the focus. So typically, people that have pain, significant amounts of pain, will be better off seeing a physiotherapist and to help manage that pain. Whereas if your pain has subsided, or your key focus is now improving your strength, improving your balance, improving your coordination perhaps, or general health and fitness, that's where you would see an exercise physiologist primarily. Now let me clarify. That doesn't mean that a physiotherapist doesn't give you any exercises. They may give you some exercises, and also doesn't mean that an exercise physiologist doesn't give you any passive treatment modalities, they may. But the vast majority of professionals, in terms of physios and EPs, in terms of the training, in terms of how they are operating in the real world, those are the major differences that you'll see. So that's it, guys. That's what an exercise physiologist is, and also how we're different from physiotherapists and personal trainers as well. If you like the video, please go ahead and press the like button. But more importantly, if you have any questions or you feel like I've left something out, something's not clear to you, please put it in the comments below and I'll try and get to it as quickly as I can. And lastly, if you found this video helpful, or you know someone who may benefit from this information, perhaps someone who could benefit from seeing an exercise physiologist, then please go ahead and share it with them. That would mean the world to me. I would really appreciate that.